So how's a lip lift done? Well, from a patient perspective, it's actually pretty simple and easy. Most described that this was way easier than any sort of dental appointment that they had because it's a local procedure. We do some numbing. It takes maybe an hour, hour and a half in certain other cases, but it starts off with the most important part, and that is measuring. That's about 50% of the battle here. So before we even get into the operating room, we measure. We measure to the half of a millimeter to make sure that we're getting the ideal results. And we want to make sure that we lift enough to get the benefits, but not too much to get all the negative effects. So when we do all our markings and measurings, and you may have seen this online, we have some pictures of it, that is when we're saying we're ready, we're going into the operating room, we do our injections. So a few little sticks and burns, we do a little bit of a block. Again, this is very similar. I always use dental procedures because most people have experiences with it. It's a quick stick burn. We use a little vibrating device to help offset that, sometimes a little bit of cold. And after those few seconds, you do not feel anything. So even though the procedure is about an hour to an hour and a half, most patients report they thought it was about 20, 30 minutes because they do have some medication on board, some relaxing medication that really helps it come along nicely. What we do on our part while the patient is relaxing and resting is we make our little incision down over here, we lift up all the skin, we take out the excess skin, and then we advance. It's not simply a skin removal. That would be easy. Then we would just cut out and suture it. But it's what we call in plastic surgery a flap advancement, meaning we lift up this and we bring it up. We anchor it deep. We want to make sure that we anchor it to the points that aren't just going to move. When the nostrils move easily, we anchor it deeper over to the strong ligaments and layers overlying the bone over here so that the nostrils don't pull down. We also, this is prior to the surgery, we assess to make sure if we need to do a corner lip lift. And that's actually even a little bit easier, but still very detailed. We make our little incision down along the lip line. So we hide it at that transition zone. We cut out a little bit of extra skin. And again, it's an advancement. So we lift up the skin and we bring it up. We secure it in the deep plane and then we suture up the skin. So essentially that's how it's done. From our perspective, it is a very detailed, very meticulous, and very nuanced surgery. From a patient's perspective, it's really come in, have us measure, few little injections, hour, hour and a half, the procedure is done. Right after the procedure, you do have a lot of swelling, but it's really not a lot of pain. Most patients go over to Tylenol even the same day, but it just feels very tight in this area because you start to get swelling. Swelling is one of those things that's very variable, and we get a little bit more into the recovery part in another video, but some patients swell moderately, others swell more, and there are different factors to that. But that is essentially the procedure from the patient perspective.